A very common condition to young mothers, they see a baby, and I think one eye isn't focusing with the other eye. It's a little bit off to the side. And what is that thing called? Lazy eye or something like that?
Well, actually, most people call it a lazy eye, but that's not actually the correct term. It can either be a crossing eye or a wandering out eye. A lazy eye actually refers to when one eye doesn't see as well as the other, and that can be caused by the eye wandering, but it can also be caused by a lot of other things. But when you have the eye wandering out or turning in, the medical term is strabismus for that. But when the eye is crossing in or wandering out, that should be evaluated by a pediatric ophthalmologist in order to make sure that there isn't any condition that either needs to be treated with glasses, with surgery, or if there is a lazy eye caused from it, meaning that one eye doesn't see as well, you also may need to be treated with patches. And that involves patching the better seeing eye in order to force the child to use the worse seeing eye in order to strengthen the vision in that eye.
If surgery has to be done, when is it usually considered?
Surgery is usually considered any time after 6 months of age if it's needed. Probably it should be done within the first year when the eyes are crossing or wandering out, and probably the sooner the better.
What's this term, amblyopia? What's that mean?
Well, amblyopia is what I was referring to as lazy eye. That is when one eye becomes lazy because the brain has decided to focus on one eye instead of the other eye. It could also be caused when both eyes don't have good vision, such as if somebody was born with cataracts or somebody had needed glasses and never got the glasses that they needed. They could cause both eyes to be lazy. And the treatments have to, with each of them, have to do with, first, if there is something blocking the vision, to clear it out of the way. If they need glasses, to get the child in glasses. And if there's an imbalance between the two eyes, then sometimes a patch is needed to patch the better seeing eye in order to make the worse seeing eye see better.
There's a thing called pseudostrabismus. What is that for me?
Pseudostrabismus is very common. Pseudostrabismus, most babies have a much flatter nasal bridge, like compared to mine, or a wider nasal bridge, and sometimes with prominent epicanthal folds, which is an extra piece of skin closer to the nose, between the eye and the nose. And when the child looks to the side, you see less white in one eye than the other eye, and to an untrained eye, this looks like that the eyes are crossing in. However, if you look at the pupils of the eyes and see what they're focusing on and test them functionally to see what they're focusing on, both eyes are actually truly straight. So it's really an optical illusion that's making the eyes look like they're crossing in. And especially it's more prominent in pictures where you don't have the three-dimensional cues that we have when we're in person. So a lot of times you'll see it worse in pictures, and if you don't notice it in real life and only see it in pictures, there's a chance that it's just pseudostrabismus. However, anything that you think is crossing in probably should be evaluated by a pediatric ophthalmologist or other specialist to make sure that there is not any true crossing of the eyes or true turning out of the eyes, because sometimes it's hard to discern what's true and what isn't true.